Hello and welcome to another session of Dr. Miller's NCLEX review. Today we're going to be talking about the cardiovascular system. As you know, for sure, you will have questions regarding the cardiovascular system. It is so important for you to know about cardiac enzymes. Okay, so let's start with cardiac enzymes. What are the cardiac enzymes that you should have an idea, okay, in the event that they will ask you about cardiac enzymes? So cardiac enzymes are released when the heart suffers ischemia. What is that? Lack of oxygen going to the heart. Troponin, that's one cardiac enzyme that is considered to be the most specific of all the cardiac enzymes. The troponin will increase during an event. Okay, so let's talk about all the cardiac enzymes. The creatinine kinase MB, the expected range, okay, their onsets and their durations. For example, the creatinine kinase, the onset would be 3 to 6 hours, duration 2 to 3 days. The troponin T, the onset is 2 to 3 hours, duration 10 to 14 days. Troponin I, the same, 2 to 3 hours for onset and duration 7 to 10 days. Myoglobin, same 2 to 3 hours, and that lasts for 24 hours. Let's talk about coronary artery disease. Narrowing or obstruction of the coronary artery due to plaque buildup or atherosclerosis, okay, from eating fatty foods, smoking. Those are the contributors for coronary artery disease. How do they diagnose coronary artery disease? EKG, okay, or catheterization or blood lipids test, elevation. It will show that the patient has coronary artery disease. Education, you want to educate your patient about potassium, okay, fat, to increase fiber in their diets and exercise, okay. This condition they will have a decrease in perfusion, they will have hypertension, angina, and at risk for a myocardial infarction, heart attack. Another condition that could impact negatively on the cardiovascular is that of aortic aneurysm. Okay, what's the pathophysiology of aortic aneurysm? Stretching of the medial wall of an artery caused by vessel weaknesses. What are some signs and symptoms or clinical manifestation? Thoracic, neck, shoulder, decrease in back pain, increased heart rate, dyspnea, abdominal, pulsating mass in the abdomen, abdominal, back, both abdomen and back pain, and it can rupture, severe abdominal and back pain, shock, and decrease in blood pressures. How do they diagnose aortic aneurysm? Ultrasonography, a CAT scan, or arteriography. The nurse must monitor patient vital signs, check peripheral pulses, assess for abdominal tenderness. You want to ask the patient if their abdominal or back pain is present. Let's talk about shock as it relates to the heart, cardiogenic shock. What's the pathophysiology of cardiogenic shock? You will have a decrease in the cardiac output. Remember, the normal cardiac output is between 4 to 8 liters. They will have decrease in tissue perfusion, usually caused by coronary artery blockage. What are the signs and symptoms of cardiogenic shock? Hypotension, the blood pressure is going to drop. Pallor, patient will have tachycardia, very fast heartbeat. Disorientation, patient will have chest pain. Cool, clammy skin. What's the nursing care? You want to administer O2. You want to give morphine, sulfate as ordered. Remember, before you give morphine, you must check the patient respiration, because one of the side effects of morphine is respiratory depression. So you want to chart the respiration before you administer morphine. You want to prep for intubation. Possibly the patient would need to go on a mechanical ventilation. Okay, so you want to monitor the blood gas levels. Remember, you got to know your normals. The pH, the blood gas, is 7.35 to 7.45. The partial arterial oxygen is 80 to 100. Partial carbon dioxide is 35 to 45. And your bicarb, 22 to 26 milliequivalent. Let's talk about dysrhythmias. You have your sinus dysrhythmias, say tachycardia, regular cardiac rhythm. Heart rate is going to be greater than 100 beats per minute. And what are the causes? Physical exercise or physical activity. Anxiety is a factor. Fever, pain, anemia, medications, compensation for cardiac output, or blood pressures. How do you treat that? You got to treat the underlying problem. For example, if the patient is exercising and patients start having fast heart rate or tachycardia, you want to stop the exercise. You want to instruct patient. Okay, the next dysrhythmia that falls under sinus is that of bradycardia. Regular cardiac rhythm. Bradycardia is when the heart rate is less than 60 beats per minute. What's the causes? Vagal stimulation, cardiovascular disease, infection, hypoxia. Hypoxia, decrease oxygenation to the tissues, medications, normal in athletes. So sinus bradycardia, it is normal in athletes. How do you treat sinus bradycardia? Atropine, Remember, atropine is an anticholinergic drug, and the boards will ask you what are some side effects of atropine. It dries the secretion. It causes dry mouth. Okay? So atropine can treat bradycardia and pacemaker. A pacemaker for symptomatic bradycardia. Bradycardia is when the heart rate falls below 60. Sinus arrhythmias, normal variant from the normal sinus rhythm, where the heart rate increases slightly with inspirations and decreases slightly with expiration. That is sinus arrhythmias. What are the causes? Common in children and typically disappear with age. There is no treatment for sinus arrhythmias. Let's talk about atrial dysrhythmias. What are some related factors? Heart disease, cardiac surgery. As we go through the aging process, older age, diabetic patients at risk for atrial dysrhythmias. Remember, AFib, the heart rate could go up to 600 beats per minute. So it's between 350 to 600 beats per minute. Rapid and disorganized depolarization of the atria, causing the atria to quiver or fibrillate instead of fully squeezing. This causes blood to collect on the atria, placing the patient at a high risk for clots. Okay? Patient with atrial fibrillation, they're at risk for stroke. So it is imperative for them to be on anticoagulants, blood thinners. Okay, how do you treat patient with atrial fibrillation? Cardioversion, mean they're going to shock the patient, the heart, to go back to its normal rhythm. Or they may do ablation. Atrial flutter is another atrial dysrhythmias. Atrial flutter, abnormal electrical circuit forms in the aorta, causing the atria to depolarize to 250 to 350 times per minute. How do you treat antiarrhythmias? Cardioversion. Let's talk about ventricular dysrhythmias. Ventricular fibrillation, the pathophysiology, the ventricles depolarize in a completely disorganized way. What are the signs and symptoms of ventricular fibrillation? Cardiac output decreases. Okay, no pulse, blood pressure, respiration, and patient is unconscious. How do you treat ventricular fibrillation, which is a life-threatening situation? Is a medical emergency. You would want to activate the emergency response team. You want to administer or initiate cardiopulmonary resuscitation, CPR, because the patient has no pulse. Then you could defib after and administer O2 as order. The next ventricular dysrhythmias is that of premature ventricular contraction. What's the pathophysiology of PVC? The ventricle contracts prematurely due to impulse initiation by the Purkinje fibers instead of the SA node. What the nurse needs to assess: O2 saturation. You want to monitor anticoagulants, blood thinners, and also you want to monitor electrolytes as order, your potassium. Okay? Bigeminy. When they say bigeminy, the PVC every other heartbeat. Trigeminy, every 3 heartbeat. Quadrigeminy is every 4th heartbeat. So please to go over these dysrhythmias. It is so important for the NCLEX. Let's talk about myocardial infarction, a heart attack. The pathophysiology, cardiac tissue no longer has oxygen supply, which can lead to necrosis, blockage of one or more arteries of the heart. What are the clinical manifestations? Chest pain, shortness of breath, nausea, back pain, diaphoresis, pallor, fever, and anxiety. Remember, myocardial infarction affects the female in a different way. The female may woke up with a toothache. The female may have back pains instead of pain radiating down the left arm. You will most find male get that pressure in the chest, pain that radiates in the arm. And in contrast, the female may have toothache, back pain, okay, abdominal pain. They call those referred pain. So you got to monitor these patients a little bit differently when it comes to myocardial infarction. How do you diagnose? Remember, the cardiac enzyme, the troponin levels going to increase. All the enzymes, or the cardiac enzymes. However, the troponin would be the first enzyme to be elevated. You want to administer oxygen. You want to establish an IV access. You want to obtain a 12-lead EKG. Remember, with a 12-lead EKG, it visualizes the entire heart. You want to administer thrombolytic therapy, okay? You want to assess the pulses. You want to monitor for blood pressure changes, okay? Remember MONA. If you can remember MONA when it comes to a myocardial infarction, MONA means the morphine, pain, and relaxes the heart when you administer morphine. O represents oxygen. You want to increase oxygen in the heart. Nitroglycerin is a vasodilator. It vasodilates. And aspirin is a blood thinner. So know the acronym MONA. M is for morphine. O is for oxygen, N is for nitroglycerin, and A is for aspirin. The other is percutaneous coronary intervention. The procedure is to open the coronary artery, performed within 2 hours of a myocardial infarction. The catheter with a balloon is threaded through the blood vessels, usually the femoral artery, up to the blocked coronary artery. The balloon is inflated that allow the stent placement to restore blood flow. Post-procedure, you want to monitor the patient for bleeding. You want to check the site for bleeding. You want to check perfusion to the extremity. The pulse, temperature, color. You want to monitor for complication. For example, artery dissection and thrombosis, meaning re-occlusion of vessels. Let's talk about pacemaker. And what is that? It's the device that provides electrical stimulation of the heart when the natural pacemaker in the heart doesn't maintain proper rhythm. You do have different types of pacemaker. You have atrial pacemaker used with the SA node failure. The sino-atrial node is no longer working. They will use the atrial pacing. Ventricular pacing used with complete AV block, and AV pacing used with SA node failure and complete AV block. What are the pacemaker modes? You have 2 modes, asynchronous and synchronous. Asynchronous, it fires at a constant rate regardless of the heart's electrical activity, and synchronous fires only when the heart's intrinsic rate falls below a certain level. Post-op, nurse